Hi everyone. Today I'll be speaking with Louise Butcher, a data scientist from the Hartree Centre. So today Louise and I will be discussing some of the challenges and solutions to collecting good quality data, specifically in the context of running longitudinal studies that are exploring student mental health and well-being. So as we know, there are several universities running or about to start running longitudinal studies to explore student mental health and well-being throughout a university. These studies collect different measures, potentially at different times throughout the year, and there's some variation in the measures that they collect. They might collect different demographic information. However, we also know that there is some overlap between these projects, so they might collect the same measure, or they might collect similar demographic information that we can compare. There's also an interest with some of these studies to link some of the survey data with pre-existing data that might be collected from the institutions, such as module grades or access to student support services. So SMaRteN wants to support the linking of these studies across the universities and within the universities to support the linking of these data sets to try to get a better understanding of the larger student mental health picture across the universities involved. We want to explore the feasibility of developing an open access database across the longitudinal studies so that more researchers can use this type of data to better understand student mental health. So Louise, thank you for joining me to discuss this. And I wonder if you could start by introducing yourself and explain a little bit about what you do.
Thanks. So I'm Louise Butcher. I'm a data scientist at the Hartree Centre, which is a centre for the acceleration of adoption of digital technologies. So data science, artificial intelligence, machine learning, specifically for UK industry. We're part of UKRI, UK Research and Innovation, which is the non-departmental government body responsible for the UK's research, so the research councils and so on. And in short, I suppose, I use data to solve problems across all sectors and sizes of organisations. So companies will come to us with problems, such as maybe wanting to be able to predict what maintenance might be required on equipment in future. And we work with them to find solutions. So that might involve setting up a data pipeline or using some machine learning. Personally, I have a particular interest in geospatial data and also in work with the NHS. So to give you an idea of an example there, one project we did with the NHS was to bring together some different data sources to forecast what additional care patients would need when discharged from hospital. And that involved combining data sources from GPs, social care, hospital admissions, and so on. And so from that, we were able to both build a good predictive model to predict the care needs, but also to add insight by showing visualizations of how patients flow through the system and what complex combinations of care needs they have.
That sounds absolutely fascinating. So Louise, earlier I explained a little bit about the background context to some of the different longitudinal studies that we're trying to link together in the context of student mental health. And I wonder if you could talk a little bit about some of the challenges of linking different data sources.
I think the biggest challenge when linking together different data sources is having good quality data for linking keys. So whatever reference number or personal identifiable keys you're going to use to join these data sets together. So if you're using student registration numbers, for instance, they need to be present and accurate in every data set you want to join together. Just to give you an example, in the NHS work I mentioned, we found that 25% of the admissions were missing the NHS number, which is what we were trying to link the data together on. And between the different data sets and keys missing in those, we started off with 1 million records, but could only link together 57,000 of them. So it's a massive hit in the amount of data you can actually use. It can be a particular problem where, as we had it, the data is anonymised because there's no way to reconstruct that person's identity by design. So this is important when doing surveys. So if you can pre-populate that information, or certainly make sure you get any registration numbers or keys that you need, perhaps, put those in advance. If you need to link data from different places, then they might be using different references. You might need some form of data dictionary to tell you how that all joins up. And Also, if you are linking together different data sources, which may be a bit sensitive like this, then thinking about how and where any anonymization happens, so that you're making sure you can still link together those data sets. And be careful with the anonymization, because in linking things together, you may actually run the risk of de-anonymizing that data again.
So it sounds like there's quite a number of different things that we need to get right to make sure that we don't risk missing data when we try to link it. So Louise, I wonder if you can talk us through some of the practicalities of linking different data sources within and between institutions.
Well, I think one of the important things to get, as I mentioned, is making sure that keys are present as far as possible, and that may mean pre-populating data, or making sure that students know what data is being asked for if they are asked to provide that data. But at a very practical level, when you're bringing together these different data sources, you need to deal with some issues such as consent, because students will be consenting to how their data is used. And so if you're joining that up between different institutions, then you need to make sure that the necessary consents are in place for that data to be shared between institutions. And it's quite possible that you'll need some form of data sharing agreements between those institutions as well, to make sure that everything is done in a legal way that's compliant with GDPR. I mentioned anonymisation earlier, and under GDPR, if data can be de-anonymised, it's still personal data, but it does still need to be linkable. So you need to think about where and how that anonymisation is done. Also, you need to make sure on a purely practical level that you have the means to transfer data securely. Just sticking it on a Dropbox is not sufficient. And where you're going to store that data, depending what sort of volumes of data you have to transfer. And practically, if you are getting data from university systems, then the people who are responsible for that need to be very much included in the planning process for how that's going to be accessed and shared. And they need to be happy that any data they're supplying, that meets all of their necessary data agreements and data responsibilities.
Mm-hmm. So it sounds like you're already giving us some really helpful practical advice, and it may well be that you've already answered this question. But I wonder if you have any advice or perhaps an example of how we might go about linking data from different universities.
Well, when you're looking at data from different universities, then perhaps move slightly beyond, keys that would identify individuals, and more onto thinking about comparable metrics. So one thing to consider is, if you've got, say, demographic fields such as ethnicity, are the metrics that you're trying to compare between universities really comparable? They might look superficially similar, but if the underlying definition is different, then you're at risk of losing some accuracy. And even the different wordings of questions in surveys could make the answers non-comparable to some degree. Now, if these things are already in place and there's no alternative, you may wish to proceed anyway, but with some caution and thinking about the possible errors that might come from doing that. And probably the thing is, to look for what best practice is in the field in question, to see what other people have done, what's generally been done in the literature. In some cases, you might think about needing to do some grouping between age groups or demographics to create something that's comparable. But of course, you always risk losing some of the fine-grained data when you do that. So if you can, I would always suggest that you record things such as ethnicity or age at the finest level you practically can. You can always aggregate them later, but if you've never recorded that data, you can't recover it. And that will give the opportunity to, say, pick age bands that are comparable between different universities, rather than, say, having the difficulty of one institution looking at, one age range and the other, an overlapping but different one. And, if you do have the potential, then I think it's important to try and discuss any of those groups or categories between universities, and ideally agree some common standards or use some standards that are already available from the Office of National Statistics, say, or something that's commonly used within the field.
That's a very good point, because some of the universities that we're hoping to get involved with, they have already started data collection. So it will be that we explore some of those routes that you suggested there. However, fortunately, some of the longitudinal studies haven't yet started to collect data, and they're still in that planning phase. So what advice would you give to these institutions that would allow them to link data with other longitudinal studies and other institutions?
I think it is really about creating a bit of a dialogue, talk to other groups to see what they're doing, see if you can agree on some definitions and what you'll be able to link your data together on. If you've got some common practices, then that will make it much easier later. You may even want to think about some training for those doing the work and surveying to ensure that the data is collected consistently and recorded in the way that it's needed. Also, if you're just starting up, then I would say think very carefully about what you want on your consent form. You can only do with that data what consent has been given for, so make sure you include what you actually want to do with it, including anything involving other institutions if you want to be able to share the raw data. And on a similar vein, think about any data sharing agreements that may need to be in place at an institutional level, and bring in the people who would need to be involved with that early. If you're looking at people who are administrating, say, data in student databases.
All sounds like very good advice. So I wonder if you could continue giving us some good advice. There's a lot of talk about good data. We need high quality, good data. And so a lot of the studies that we're going to be working with will be using survey data, but they may also be linking that with institutional data. So I wonder, from your point of view, in your day-to-day work, what do we actually mean by good quality data, and what are some of the tips that we can do to help us collect good quality data?
Yeah, I mean, I think to me, I would say good quality data is really that which best reflects reality and enables you to answer the question that you've posed. So that would mean having complete data, especially where that's essential to doing the linking, data that hasn't got any errors or spurious values in it. And especially where surveys are involved, there's a few things you can do to make that better. Be very careful about having default options, especially where the survey is being done online. But even where if you're doing something on paper or someone's entering it online, people have a tendency to choose default options if they're there, or perhaps even hit enter by accident and not realise that that's what they've done. And you can easily see that in poor quality data. So also, don't make surveys too long, or people will either give up or resort to just making up answers or putting in the same thing everywhere. You're bound to have some local experts who can advise on this. Psychology departments are often very good at this kind of thing. Make sure there's some consistency in how questions are asked. If there's any room for things to be changed, try not to change things halfway through, or if someone is asking the questions verbally, then make sure that's consistent. Then another important point is about how to choose the sample of people that you're asking the question to and sampling. You know, if you were to just choose people who responded to an advert or clicked on a link, then there's always the risk of the bias of that self-selection. So you need to have a strategy for doing that, whether that's random or picking a representative sample to look at particular numbers from different demographic groups. But, you know, choosing how to do that sampling is an important point to get to representative data. And as I mentioned before, think carefully about what you're going to do with that data and tailor the consent appropriately.
Fantastic. Well, Louise, you've certainly given me a lot to think about, and it's helped to inform some of the discussions that we'll be hoping to take these issues forward during the event that SMaRteN will be running on the 30th of June to bring together individuals who are working on longitudinal studies already or wanting to set them up in the future. So some of the top tips that you've given us, will absolutely be sending them into the event on the day, and hopefully get some concrete solutions moving forward as to how we might take this larger project forward. So Louise, thank you for a very interesting conversation, and I look forward to seeing some of you on the 30th of June.